It's my pleasure to be chairing VENT today for the Human Animal Trust. I'm Roberto Larragione, Professor of Veterinary Microbiology and Pathology in the School of Veterinary Medicine here at the University of Surrey, but also head of the School of Biosciences here. And today is really about us thinking about one medicine and what it means to us all, and having an open discussion about how we can bring one medicine to the forefront so that both our colleagues in scientific disciplines, medical and veterinary disciplines, but also the general public understand what one medicine is. So I'd like to start off by asking everybody to introduce themselves so that we just have that on record and that we also all know each other and our background. So I've introduced myself and I'll pass to Noel to introduce himself and then we'll go around the table.
Thanks, Rob. Thanks for chairing the session. So I'm Professor Noel Fitzpatrick. I founded the Human Animal Trust 10 years ago this year because I was extremely frustrated as I studied veterinary medicine and in so doing human medicine to realise the lack of cooperation, the lack of symbiosis, the lack of synergy that occurred between the two. And I got offered, don't worry, I won't go on too long. I got offered veterinary medicine and human medicine the same day in 1985. And I chose to be a veterinary surgeon. And if I did or had chosen to be a human surgeon, then I would want to do my very best for my human patients. So it was extremely frustrating for me that I wasn't really doing my best for my veterinary patients because we weren't allowed access to the drugs and implants that animals had given to humans, but I couldn't get access to them for animals. So that didn't make sense to me, and that's why I founded it. Since then, started the veterinary practice, got specialised, did a few exams here and there, helped found this veterinary school, and then now try to spread that message in the media across to the public, and I think the public are beginning to realise that animals, especially companion animals, are integral family members and they want the same level of care for them as they do for themselves. But more importantly, we are as a society beginning to realise that it's a shrinking planet with shrinking resources, and my central life's goal is to try and make people understand that we are all connected because we are all animals. And if I can create a more fair platform by the time I finish than when I started, then that's the contribution I would like to make. Thank you.
Thank you.
I'm Dr. Ron Daniels, so I'm an intensive care clinician working with humans in Birmingham in the UK. I'm also the founder and chief executive of a UK-based charity, the UK Sepsis Trust, as well as vice president of the Global Sepsis Alliance. And I'm here following a chance meeting at the House of Lords with Joe Bailey, in which we were discussing the impact of antimicrobial resistance, the impact of untreatable pathogenic illness in humans as well as animals.
Fantastic. Danny.
So I'm Danny Chambers, I'm a vet. I treat mainly horses these days. I'm on the Council of the Royal College of Veterinary Surgeons, and one of my most interesting roles is I'm a trustee of the charity Vet Life, which is a mental health charity for vets. And I've had a very long interest in One Health in particular. We talk about One Medicine here, and we've been talking about the difference between One Health and One Medicine. But when I was a student, I did a master's in epidemiology and infectious disease control, which got me interested in things like rabies control in various different countries, and how there's many situations where the cheapest and most effective intervention, even if your primary aim is to improve human health, is to actually address animal health. And so that's been one of my long-term interests. So I'm running for Parliament this year, or whenever the election's called, we'll see. And we'll see. And one of my main motivations for doing that is because only about 8% of MPs have any sort of science background. And you look at the challenges we face at the moment. We've got risk of pandemics, we've got climate change, we've got antimicrobial resistance, which you just touched on. How do you feed 8 billion people and give them energy sustainably? And these are not only global challenges, but they're science challenges as well. And I think if we had a more evidence-based approach, the same way we have evidence-based medicine, if we had a more evidence-based policy approach, we'd better solve a lot of these problems. And so that's my big passion at the moment.
Fantastic, thank you.
Hi, I'm Dr. Helen Cohen. I'm a consultant in rheumatology. complex pain and rehabilitation at the Royal National Orthopaedic Hospital. I'm a bit like Noel. I'm from a West Country farming family, and I didn't know whether to do human or veterinary, flipped a coin and it came down human. But that means I spent my life going around, we were on a small holding. Dad was the local vet, so we moved around all the counties of the southwest, except Cornwall. So I grew up going out with vets, treating animals on the farm. Gosh, I remember taking in one of our sheep, I think, had dropped dead. I remember taking the heart into school to show them what the hole in the heart looked like. So I grew up with that sort of thing. And like Noel, doing medicine, got increasingly frustrated that all these skills that I'd already learned from a young age in dealing with looking at an animal and reading the body language and not having to just rely on what people tell you, it just wasn't happening in human medicine. And the stuff that I knew about from just growing up with that wasn't being applied in humans. So as I've got further through, originally I wanted to go and do a vet degree as well and specialise in zoonoses. Couldn't afford it, so I carried on doing human medicine. Ended up in rheumatology because it was the most general I could get at the time. And find myself coming back towards the veterinary now because the rheumatology, our speciality, has exploded in terms of the drugs we can use, the biologics. And again, my sister is a human physiotherapist who's gone on to do the animal accreditation with the RVC. And I'm forever getting stuff coming from her. What do you think of this? What do you think of that? And I sort of blindingly obvious in a human, it's this. And just that overlap is there all the time. And it's so frustrating seeing things that where my knowledge could help the vet knowledge could help me. And as you say, that lack of communication, that lack of drug knowledge, it needs to be addressed. So I'm very passionate about applying the skills that we have. So for pain management, that's a huge area in veterinary medicine now. And as I say, the inflammatory rheumatology side is going to be another huge area in veterinary medicine. And we've already seen the experience from the failed anti-TNF drugs in humans being applied in veterinary medicine. So I think there's a huge amount we can learn from each other. And I equally get frustrated at this thing that humans are special and we're not animals. Of course we are.
Wonderful, thank you.
Hi everyone, Matt Morgan. I've got 3 bits to my life. I'm a full-time NHS clinician, also working in intensive care in Cardiff, which is a big, busy intensive care unit, about 40 beds, one of the biggest in the UK. The second bit is research. I did a PhD in sepsis actually, and I'm a clinical professor at Cardiff University and Curtin in Western Australia, and mainly run big platform clinical trials in humans. And the third bit in my life, which I'm enjoying the most really now, is public engagement. I wrote a book about intensive care medicine in 2019 called Critical, which did well. There's lots of newspapery stuff and other media things as a result of that. And partially thanks to visiting Noel's practice actually in 2016 with colleagues from intensive care. I wrote a book last year called One Medicine, conveniently titled, which is a bit different. It's not a book about frustration, it's a book really about amazement and how amazing animals can survive at the extremes of life and how that can help people like me working in intensive care. Other bits of public engagement, I write a regular column for the British Medical Journal. I'm a member of the NHS Commission of the Future of the NHS by the BMJ, and I've just finished helping Michael Sheen in his play Nye actually. I'm the medical advisor for Nye, which looks at the history of the NHS and is in the National Theatre at the minute in London. So thank you.
Thank you. Hi.
Thank you. I'm Dr. Mary Fraser. I'm a vet, qualified 30 years ago. Did all the James Herriot mixed practice, did all of that, went back, did a PhD in canine atopic dermatitis with guide dogs, and spent a lot of my time working with human dermatologists. A lot of my training was going to human dermatology meetings. Then I moved into education and vet nursing, and was based within a human nursing school teaching vet nursing for a number of years. Then jumped into the corporate world in education within the veterinary sphere, jumped to innovation, worked in an innovation centre at Stirling University, and most recently, 2 years ago, moved to the Royal College of Physicians of Edinburgh, where I am Director of Education, Training and Assessment, overseeing CPD provision, education provision, and also PACES exams for people going on to become consultants in the world of medicine. So I've had quite a good experience of working with human side of things and the veterinary side of things, and trying to bring it together and getting a little bit frustrated sometimes and trying to work out why are there these challenges that we have to overcome.
Fantastic. Well, I think we're extremely privileged to have such a breadth of knowledge here today. It's clear to me that we've got the right people in the room, and we've got a huge amount of enthusiasm for One Medicine, and really fantastic also to hear the different stories about how everybody's come to understand what One Medicine is. But today is all about, as I said before, really thinking, how do we take that forward to the next stage? To have an open discussion around some questions, which hopefully all of you have already had an opportunity to look at. And I want to open with the first one, which is probably the biggest one that we really want to start with. And that is, what is One Medicine to you? And what does it mean to you?
And for me, the reason One Medicine is amazing is because every day I go to work, there are 40 patients sick enough to die. And the reason they don't die is because we manage their physiology at the extremes. And I used to think as a human doctor, we're very clever doing that. Oh, isn't it amazing how we breathe for people with COVID or asthma? And actually, if you just open your eyes and your ears and see a giraffe breathe, giraffes have been doing this for 20 million years. They breathe the same way as I ventilate people with asthma. But those barriers stop us from realising that. So for me, One Medicine is very much about that direct relationship, learning from other species without barriers. It's different from One Health, a bit like the WHO is very different from what I do in hospital. That's all about massive picture, policy, governance, determinants of health. And for me, the bit of One Medicine I'm fascinated with is that beauty of life, really. So that's what the difference for me.
That's brilliant. I think we all see that One Health has always been very much around the infectious diseases and driven around that. And I think that's led to a course where everybody feels that One Medicine maybe is similar. And that's really, really difficult now to unpick. And how do you think we ensure that the public, for instance, understand what One Medicine is and don't get it confused with One Health?
You know, like everything in life, it's probably about education and awareness. You know, I think doctors and vets should train together. I think nurses of humans and nurses of non-humans should train together. I've talked before about having a single oath. Why is it that human doctors swear an oath to one species and vets swear an oath to every other species on the planet? It's crazy. Why don't we amalgamate that through the Medical Schools Council, through others? It wouldn't be a difficult thing to do or a risky thing to do. And I also think in human medicine, we've gone through normal physiology, which we call physiology. We've gone through pathophysiology. We've got biomimicry out there in technology. What we haven't got is sharing those lessons from physiology in life. And perhaps we need a new specialty of zoophysiology or biophysiology, and that could be a cross-discipline, you know, inbuilt, ingrained in the curriculum. So I think it's probably about education, probably from the medical side, actually.
Great. Danny, any comments from your perspective as an equine vet?
You're very eloquent the way you described that. I think to touch on what Nolan, what we were just talking about, I grew up on a farm as well, and I loved science at school. And when I got to deciding what I was going to do at university, I could have gone either way for medicine and veterinary, and probably because I'm from a farm, I went down the veterinary route. But it's I think when you come with a more veterinary background, especially when you've been on a farm when you're younger, you don't differentiate between human and animal medicine really until you sort of graduate, and then you realise that, you know, your friends who are doing medicine are doing very different jobs and working in a very different sort of industry to what we're doing, and it's and I suppose it's frustrating that you have to even have a conversation that animals and humans have the same challenges and issues and they're interrelated. And like you say, it's not about just infectious diseases. There's everything. We touched on that, you know, the mental health benefits of the interaction, plus the innovation you can get from looking at, you know, nature's solutions to things. But I guess it's I guess the thing I find slightly frustrating is taking a slightly big step back to One Health. And the reason I mention it is because I remember I was at a conference where a doctor was talking. They said One Health, that's the stuff that the vets do. I thought, no, that's someone who hasn't quite understood it. You see what I mean? It's that mindset. And occasionally, as a vet, when you'll be diagnosing a dog with a condition, and you'll have a human doctor, for want of a better term, he'll go, "Oh, do dogs get that as well? You know, like pancreatitis or something." You're like, yes, and I guess if they'd thought about it, they'd probably realise. But it's an absolute shock to them that a dog can get what they see as a human disease. So to touch on it's really just to reiterate what you've said, I don't see a difference between them, and we need to somehow work out where does that difference come in? At what point? Is it at university? Is it once you start working? Is it even before you apply for university? Why are they? Is it society? Is it children? At what point are they separated? Because there's no logical reason for them to be as separate as they are. That doesn't answer your question, but I've said enough.
No, but I think you're right, bringing both of the disciplines together from a perspective of medics and vets, and certainly within many universities where they have both schools now, there's an opportunity to teach students together. And that used to happen many years ago, and then it went in a different direction, and now it's going full circle again. But I do agree with you from a perspective of One Health. That's been a very veterinary terminology. How do we now get our vets and doctors, but not just those, all of the other professionals, whether it's dentists, nurses, etc., to understand what the difference is between One Health and One Medicine? And I think One Health is very much about bringing animals, humans and the environment together. One Medicine is thinking holistically about that whole approach to how we can help each other. And whether it's reciprocity from a perspective of thinking a drug's been produced for humans and now could be used in animals, or a procedure that's been done in animals but should be done in humans, or vice versa, versus something which is more about how do we bring different groups together. This is more about an action, I think. But Noel, you might want to comment.
Yeah, I'm itching.
I knew you were.
Yeah. Crawling.
I could feel it.
I think we're all in a trance in the sense of ants. So I often think of the ants, the answers in the world: recalcitrance, arrogance, and ignorance. And I think it's all of those three things. And I think that's super sad. So I'll give a few examples of that to illustrate what I see as One Medicine, or medicine, depending on whether you're Irish. In a nutshell, One Medicine is a fair deal. It's a fair deal for animals at the same time as humans. Human medicine has no grasp on that. I'll give you an example of that. I was lecturing at a human medical hospital. The children remain unnamed. And I gave a lecture on trauma and on various things that we did, from Ilazarov's external fixator frames right through to internal fixation, etc., and the whole history of it. And indeed, the history is it couldn't exist without animals. So I'm giving this, and a young registrar comes up to me afterwards and he goes, "Well, that was very interesting, Professor Fitzpatrick, but why do you bother? It's only a dog." I actually felt very sorry for the guy, and I just put my hand on his shoulder and I said to him, "Let me explain that to you. Whether he got it or not, I don't know. But let's move on to the veterinary side of things. Vets live in an igloo. They, like humans, get on with their day. They treat animals, they do their best. They don't think about the fact that the immunotherapy that they need for osteoarthritis is being researched in humans, but the human company that's researching it won't buy an animal license because it costs too much money and they don't think they can make enough money back out of it." So there's a lot of recalcitrance to change because of the history of the 250 years of divergence, and also because of intrinsic bias created by our perception, our training, and our societal norms. So it is interesting because I heard yesterday from a colleague of mine who had just come back from working in another area of veterinary medicine, and some people were talking about me, and they were talking about some of the techniques that I've developed, innovated for animals, because the current techniques aren't good enough. And he said, I won't send anything to that guy because he's experimenting on animals. Now, obviously, that's anathema to me. So my colleague, who I know very well, said, but when you're treating a diabetic dog, if X doesn't work, do you try Y? Yes. Is that an experiment? No. But Noel Fitzpatrick, when he gave this lecture, said he was treating this dog with such and such a joint replacement. It didn't work out, so he changed it and he did this joint replacement. And I said, well, what is the difference between that and anything that has ever happened in the field of medicine? Nothing, except the investiture of ego, precedent, and prejudice in the context of what happens. So, to come back to the three words, arrogance, ignorance, and recalcitrance. I think it's quite simple. Most human medical students and most veterinary medical students are simply not told on day one that it's okay to not be biased. It's okay to love each other. It's okay to have an open mind about these things. The second thing about recalcitrance, so that's ignorance. And people just don't know. I mean, the registrar, God bless him, he just didn't know any better. He's not a bad person, a lovely guy. He just didn't know. He just thought it's only a dog, it's not as valuable as a human life. He didn't know any better. So that's ignorance. Recalcitrance is where we become vested in the status quo. So we both know, and those of us that work in human medicine and veterinary medicine, that you walk into an academic meeting, you slap each other on the back and you tell each other how great we are. And I got caught in that trap when I first did all the exams, became professor, etc. And I was in an American meeting giving a keynote lecture, and they told me I was great. It was great, telling them all the new technology. And then I went to the bathroom and overheard the same two guys that had just praised me criticizing me because of X, Y, Z. Now, that's both hypocritical and recalcitrance to change. They just didn't want to change. They didn't want to embrace change. And so ignorance, recalcitrance, and arrogance, all of those things come together, I think. And the biggest single challenge I think we have in getting across the concept of One Medicine isn't just the fact that the term One Health has somewhat been hijacked, because if you look at 100 scientific papers on One Health, which we did, in those 100 papers, and the 100 we looked at, there wasn't a single mention of why that was designed to help animals. It was all looking at environmental factors, animal factors, etc., to help humans. So I understand that, I get that, but if that's the status quo, that's a challenge. But it isn't just that. It's the fact that because you're on the telly, or because I'm on the telly, people think we have a vested interest in, oh, that guy's just doing whatever with his ego. But actually, that's not looking in the mirror and thinking, we share such an enormous amount of commonality. Why are we different? And to finish up, I think that it's related to human nature. We other people all the time, whatever religion, color, country, whatever. We do that. It's nonsense, but we do it. And we other animals all the time, and yet we're developing an intraspecies internet, and with the advent of AI, we will know what they're saying. They communicate the same as we do, it's just we don't understand it, and we think we're so superior because of this. So I think the fundamental challenge, so to answer the question, One Medicine is a fair deal for animals, whereby if a cancer drug is being developed for a human, animals can have that drug straight away. And reciprocally, the stuff that we develop in animals should be shared with humans, the goal being to reduce, refine, replace, reciprocate, and ultimately, hopefully render obsolete the need to do that experiment in the first place with the advent of everything that's happening. That's One Medicine. But the biggest challenge to change is an entrenched human nature issue of othering. And that's what we need to get across to people, is that they are different, but they're not other. And to quote my great Irish countryman Bono, we're one, but we're not the same. And be very careful how you read that song. Listen to the lyric of that song. He doesn't say we've got to carry each other. He says we get to carry each other. It's an honor. And people don't see that yet. So that's what I think One Medicine is.
Thanks, Noel. That's really, really great description of where we are right now.